According to a recent report by the Poor People's Campaign, Americans living in poorer counties died at almost twice the rate of those in rich counties during the COVID-19 pandemic. The study was based on income and death data from over 3,200 U.S. counties. It compared the poorest 10% with the richest 10%. It showed an even bigger gap during the Delta variant, when people living in the lowest income counties died at 5 times the rate of those in the highest income counties. During the recent Omicron wave, that divergence in death rates stood at almost 3 times. The extent to which the virus has struck low-income communities has been difficult to gauge because official mortality data compiled by the CDC and elsewhere has not factored in income and wealth information. Such a gap in outcomes cannot be explained by differences in vaccination rates. More than half of the population of the poorest counties have received 2 doses of the vaccines. A more relevant factor is likely to be that the poorest communities had twice the proportion of people who lack health insurance compared with the richer counties. Racial disparities are also obvious. Early on, it became clear that Black people and Hispanics in New York City, for example, were dying of COVID at twice the rate of whites and Asians. Bishop William Bergh, co-chair of the Poor People's Campaign, says, and I quote, "The findings of this report reveal neglect and sometimes intentional decisions to not focus on the poor. The neglect of poor and low-wealth people in this country during a pandemic is immoral, shocking, and unjust." Unquote. The U.S. is the only wealthy country not to guarantee health services for all, and witnessed the biggest decline in male life expectancy during the COVID pandemic of 29 nations, studied by Oxford University. From this report, while the virus did not discriminate between rich and poor, society and government did.